Elizabeth Morrison, in case I don't know some of the people who are watching this. I really wish I could be there in person. We're just kind of testing out using video for some training, so you guys are probably the guinea pigs on this. And I think the first guinea pig is the BOS group, so for the BOSs and the FOSs who are watching this, I really think that you guys are the ones who run the organization. So today what I wanted to talk about is how to deal with very angry patients, or sometimes we call them escalated patients. They're very escalated, very angry. But there will be more training, more comprehensive, ongoing training by people who specialize in this area. So that is coming. This is really an attempt to kind of give some helpful hints, some guidelines, some suggestions in this very difficult area. So the first thing that I want to talk about that's really important is prevention. Even though we're really going to be talking about some guidelines about how to deal with patients who are already very angry and escalated, it's just impossible to talk about that with at least not mentioning prevention. There are certain environments that all of us are in where escalations or very angry outbursts by people happen very rarely. If you think about restaurants or private doctor's offices, most doctor's offices probably. If you think about the Apple Store, and then there are environments where we think of as escalations as being fairly common. When I think of that, I think of the DMV, which I was there this year. And there are certain characteristics of those different cultures or environments that lend themselves to de-escalations or decrease the chances of escalations happening. So I'll give you an example of some of the characteristics of the DMV, which you'll recognize, which are going to increase the odds that someone is going to be very escalated there. It's very crowded, the waits are very long. The staff who works there is behind a desk. They're not ever in front of the desk or out in the waiting area. The waiting area may not be particularly well cared for, it's not very comfortable. There's a security guard there, kind of indicating trouble or problems. And all of these things sort of lend itself to creating an environment where people who do already struggle with anger management problems are going to feel more comfortable or more likely to escalate. If you think about someplace like an Apple Store where the employees are circulating very closely with all of the people who are in there, and where they're being greeted and talked to and how are you and what can I do for you, it's very uncommon that you would have an escalation in that setting. So we want to be the setting where escalations are very uncommon. And so for supervisors, for front office supervisors, for back office supervisors, for reception staff, for back office support staff, we really want to create this environment that it's unlikely that that would happen. And we can do that. We can do that. And the best possible way that we can ensure that is to really maximize our use of care skills. Care skills are certainly a way to be kind, to treat people with respect, to make in the interactions of this talk about escalated patients, those skills are also a primary way to create an environment where escalations are uncommon. Sure, they may happen, but they're very uncommon. Maybe one a year, maybe two a year. So if we are greeting everybody who walks through the door, making eye contact with them, if we're going out into the waiting room periodically, whether you're an MA who's going to call a patient out and you make a loop around the waiting room and pick up garbage and say hi to people and offer people water and make eye contact with them, your chances of escalations are going to be much decreased. And that's including in the back office, the way we talk to each other, the way we interact with colleagues, with patients. If it's very kind, very empathetic, very respectful, a lot of contact in terms of eye contact and greeting people and how are you, our chances of escalated patients are going to be much decreased.
Is
who is the best person to deal with a patient who's already very, very angry, voice raised, maybe swearing, very argumentative? And I'll tell you the best way to talk about that is to talk about 3 types of people who should not deal with an escalated patient. The first group of people who should not be the ones dealing with a patient who's very escalated are people who do not manage their own feelings well. There's sort of no shame about this if you're one of these people. If you're one of these people who gets very angry when they see somebody who's angry, if you're someone who gets very scared, if you're someone who feels very defensive, if you feel kind of paralyzed, if you have a lot of feelings when somebody else in your life is angry, you're not the best person to deal with an escalated patient. The chances of a good outcome, and I'll talk about what a good outcome is, a good outcome from when a patient is very, very angry, the chances of a good outcome are significantly increased if we have the right person dealing with that patient. So we definitely want people who have a really good management of their own feelings. That's the best predictor of how things will go, is not how angry or out of control the patient is, but how well we manage our own feelings. So that's the first thing, is just to realize that if you are one of those people who doesn't manage your feelings well, or if you know your staff and you get to, we know our clinics, right? And we know who those people are, that absolutely, as soon as they are someone who is in front of a patient like this, they really should walk away, go get somebody else, exempt themselves, and the people who have a better management of their feelings step in immediately. Hopefully that's our FOSs and BOSs. It may not always be. Certainly we would hope it be a behavioralist, but there may be other people in our clinic, or in our support staff, who are very good at managing their own feelings. The second type of person who should not deal with a patient who is escalated is anybody who has had a very unpleasant interaction with them before. So if a patient has come in and verbally abused someone before, or gotten very angry and argumentative, or hung up on the phone or swore at them before, ideally that employee would not deal with this escalated patient again. And the reason for that is that once you've been really, really mistreated by a very angry patient, your chances of being able to manage your own feelings really well are significantly lower. So no matter what position of supervisory position that you're in, if you've had an interaction with a patient that's been very abusive or particularly unpleasant, it's a really good idea to just turn to the people around you and say, I shouldn't deal with this patient, and just exempt yourself from dealing with them. The third person who should not interact with a patient who's very escalated is anybody that the very escalated patient says they do not want to deal with. So if a very angry escalated patient comes in and says, I demand to talk to the supervisor and it better not be so-and-so, or I demand to see the doctor, but if I see that so-and-so MA, I'm going to flip. Now, certainly our logical mind is telling us that there's something wrong about that patients can't come in and demand who they can deal with and who they can't, and how could that work in a clinic, and it's not right, and they have to deal with this person. We might have all kinds of things going through our mind about why that's not right, that they can decide who they deal with and who they don't. But remember, in successful de-escalation, it's never about being right or wrong. It's not about being right or wrong. It's about successful resolution of the situation. So if someone who's very angry comes in and says, I do not want to see this person, or I do not want to deal with them, we really want to listen to that and not have them deal with that person. The third thing that I want to talk about is moving the escalated patients. So this is a really, really important point, that one of the goals of resolution or de-escalation is always to remove the patient, right? So we either want them to be removed outside, we want them to be removed out of the waiting room, we want them to be away from other patients for sure. So a lot of times our goal when someone is very escalated, angry, and talking to us, we don't want to get lost in the content of what they're saying, that they're very, very angry about these things. We want to be thinking to ourselves, who's around here, and where can I go, and where do I need to move them to? So there's a couple considerations with this. One of them is the primary goal is to get them away from other patients. So if the very escalated patient is in the waiting room, you have a couple options. If they haven't made any very specific threatening or violent comments, the best thing to do is buzz them in through the back office. You want to get them out of the waiting room, pull them out of the waiting room into an office. If they've made some very threatening comments, you don't necessarily then want to invite them in the back office. You would want to invite them outside of the clinic. That's one option. Can you step outside with me here so I can help you solve this problem? Those are two options. Sometimes when someone's very, very angry, they won't go either way. So if you say, let me buzz you through and we're going to figure out how to solve this problem that you have, for example, right? And remember, it's not about admitting that they're right. It's really about getting them away from the other patients. It's very frightening for other patients to have this happen, and we want to minimize any possible harm. So we, ask them and buzz them through. We say to them, can you step outside for a minute so I feel like I can listen to everything you're saying and make sure I can help you? If they will not agree to either of those options, depending on which one you choose based on your assessment, and they're in the waiting room, it's very important then to remove everyone out of the waiting room. So if you have a very escalated, angry patient in the waiting room who's yelling or swearing, and you've asked them to move one of those places, either outside the clinic or in the back office, and they don't, then what you need to do is have the door buzzed open and escort all the patients. Just specifically say to patients, we need you to come in here, and move them out of the waiting room. So rule of thumb is, if your very escalated patient won't leave where they are, then you need to evacuate patients from that area. So the same goes if they're in an exam room. If there's a patient in an exam room and they're very angry, very escalated, and they're yelling, and you ask them if they will move to a supervisor's office or move outside the clinic, and they won't, then you need to move the other patients who are in those adjoining exam rooms, out of that area. So the next thing I want to talk about is to consider what we think of as success in these situations. Sometimes when somebody is very unhappy and angry, we typically think of success as making them happy or resolving things. Or sometimes if someone is very argumentative and we're getting really angry, we think of success as proving that we're right or we didn't make that mistake on the refill or something like that. When someone's very escalated, we need to really train our minds to redefine what is considered success. In these situations, there's a lot of ways that we would consider successful resolution, but if a patient is very, very angry and escalated, one definition of success is they leave. There's no doubt that even if they leave angry, if they leave, that is a success in these situations. We can deal with everything after that. We can call the police if we need to. We can write a variance. We can contact that patient at a later date to talk to them about their behavior. We can dismiss them as patients. We can warn them. We can talk to the waiting room if we need to debrief or if they were frightened. We can do all of those things after somebody leaves. So somebody leaving is a success. And for that reason, it's important for us to train ourselves that as someone is leaving on their own, we do not follow them. We don't go after them. We don't, find out what else we can do. We don't go after them telling them they're not welcome here anymore. We don't draw boundaries with them about not being able to return to the clinic. All of those things can be done later. If they're leaving on their own, we sit back and let them leave. And that is one successful resolution of these situations. So let me say a couple things about how to talk to people when they're very, very angry. it's really important to think of people who are very, very escalated and angry as impaired. And we've all been really angry at some point in our lives, and we all know that you say things you don't mean, that you're really sorry for, you do things that you wouldn't normally do, you're not thinking straight. We sort of know that about ourselves if we think about instances where we've been very angry. So think about when we think of a patient who's very, very angry, who might struggle much more in these areas than we have. Think of them as, even if they're not on drugs, right? But I mean, think of them that way. It's as if their brain is being flooded with a drug, adrenaline. So they are not thinking clearly, which is why we want to stay away from trying to reason with them or use logic with them or explain things to them. And in fact, what we really want to do is get them talking, not venting. It's definitely a myth that somebody who's very angry, once they vent, will somehow cool down by themselves. That's not accurate. So, but to get them talking, to get them in that other part of their brain that is not impaired is really important. So there's a couple tricks around that. One of them is that if somebody's very angry and yelling about something, to go up and hold your hand out for them to shake your hand. Hi, my name's Elizabeth Morrison. I want to help you figure out how we can deal with this problem that you have. Really has to kind of stop that part of their brain, that sort of angry, adrenaline, raging thing they have going on, to sort of stop and register who this person is who's introducing themselves. So that idea of not walking into a situation and saying, hold on, calm down, sir, you know, which is essentially interacting with them in that same way and saying, hi, my name's Elizabeth Morrison. I'm going to be the person who's helping you today with this, is one way of helping them get their brain into a different mode. The other sort of trick that we can use is to say to them something like, I really want to hear every single thing that has happened to you that we've done wrong. Can you start from the beginning and tell me all of those things, right? Obviously, you don't want to do this when they're in front of all these patients. This is after you've moved them away so that they're alone. But this is another example of a sort of trick where their mind then has to sort of process in a different part of their brain to process. Then they're starting to think back, what are all those, you know, wrongs that Golden Valley has done me or whatever. So any way that we can interact with them that isn't directly in line with this sort of adrenaline, I'm really angry, you did this wrong, no we didn't, you need to calm down. Any way that we can get them out of that, to kind of jump into this other part of their brain where they really have to reason and think things through, is really a successful sort of trick to get them to ratchet down that escalation slightly. So I know this is sort of the quick and dirty brief about these things, but just to summarize some of the subjects that we talked about really actively engaging in our care skills at the highest level we can on a daily basis with every patient that we come into contact with and our coworkers is not only going to make our jobs and our lives much more enjoyable, but it's going to really create a culture where escalations are very rare and very random. The second thing that we talked about is really making decisions about who are the best people to deal with an escalated patient. It's very important in terms of positive outcomes to have the best possible people interacting, the best possible people in these situations deal with these escalated patients. And the third thing we talked about is movement of this very escalated patient, moving them out of environments where they could be a danger to others or moving others away from them. And then lastly, a few tricks to engage their brain in the reasoning part of their brain out of their adrenaline rage brain. So those are just 4 areas with some sort of small pieces of information that I really hope are helpful. And of course, more will be coming.